Hi and welcome to an all-new episode of the OERLive Leaders Speak. The eyes, they say, are the windows to the human soul. However, what is potentially one of the most valuable sensory organs in the human body is also one that is overlooked in terms of health and care. Today we are in conversation with Dr. Juan Arbelaez, the Acting Medical and Scientific Director at the Muscat Eye Laser Center, a center with an excellence of over 2 decades, to learn more about the latest in technology in eye care, eye health, and much more. Dr. Juan, welcome to an all-new episode of the OERLive Leaders Speak.
Thanks for the invitation. It's my pleasure to be with you guys today.
Muscat Eye Laser Center has a phenomenal acceptance and track record in the Sultanate. As we move closer towards a technology-driven surgical environment, how has the establishment accepted technology into its ecosystem, and more importantly, how much weightage has shifted from doctors such as yourself to technology?
Well, the vision of our CEO has been always that Oman deserves the best. So the idea of creating Muscat Eye Laser Center, this establishment, was to create it as a top premium clinic offering the latest treatment options in eye care. For that reason, the clinic has invested since the beginning every year in acquiring the best technology available to offer to our patients. Technology in ophthalmology, the specialty of ophthalmology is one of the specialties that has the biggest involvement in technology. We have several lasers, several diagnostic devices that involve artificial intelligence, involve advanced optics. It's another level of technology compared when you are comparing normally with other specialties. So we are very technology dependent because most of our procedures and our surgeries and our treatments are in a microscopic level. So we have to put our get the help of the technology to be able to acquire outstanding and perfect results in areas that we are just limited by the microscopic point of the disease or the microscopic tissue that we are going to treat. So we depend significantly in technology, and having the best technology available is always very helpful for us to achieve very good results, to achieve very safe procedures with low risk of complications and side effects.
Thank you, Dr. Juan. That's definitely very insightful. I would like to build a little more on this question. How has Muscat Eye Laser Center, an organization that has had thousands of successful surgeries, used modern technologies to reduce surgical complexities?
Well, modern technology has helped us a lot in deliver safer outcomes to our patients with less side effects and complications. Now our diagnostic devices are more robust, so they allow us to identify if there is any baseline problem in the patient before we intervene with a surgical procedure. And surgical procedures with the lasers have reached standards of safety that are extremely high. Every day we do things different to improve our outcomes also. We are analyzing our outcomes almost in daily basis to improve them and keep improving them day by day by improving the safety, improving the patient satisfaction, improving the recovery rate of the vision. So all of the lasers and the diagnostic devices had helped us significantly into this matter to achieve these results and these safety outcomes.
Now, the medical industry, as I understand, is an ever-evolving space, and Muscat Eye Laser Center has invested quite a lot into research since its inception. I particularly want to know about the paper that was peer-reviewed in the European Journal of Ophthalmology. I'd like to know about some of the technical findings that was in it and how it was peer-reviewed.
Okay, the peer review process is to guarantee that what is going to be published has followed all the parameters and all the correct ways to create a research. in terms of ethics, proper statistics, proper organization and presentation of the results and the data, proper discussion of the data, proper planning of the research project, and that also that the presentation of the results are not biased by industry in some cases, for example. So peer reviewers are experts in the field, and the journals have teams of peer reviewers that receive each publication that is submitted for each paper that is submitted for publication to their journal, and it's reviewed by the experts in that particular subject. So the experts receive the document, they review it, they have usually between 20 to 30 days to review the document, each of them, and based on that review they will give a verdict if the paper is accepted with some corrections or if it's rejected for publication in the journal, because they will be analyzing that paper follows all the good standards in a research project. So this particular paper was submitted to the European Journal of Ophthalmology. It's a paper that is a study done in intracorneal ring segments, a new model of intracorneal ring segments that are used in patients with keratoconus. We know that keratoconus in the Middle East and in particular in Oman, it's a very prevalent condition, and this condition affects severely the vision of the patients. So having alternatives and new models of intracorneal rings help us to achieve better visual results in the patients, better quality of visions, and the most important, help us to avoid reaching the need of a corneal transplant, because we are able to improve the vision with their own corneas, make those corneas start working back again to let the patients achieve a good enough vision. So in this case, the project, the research we have submitted and it was published in the European Journal was about the new ring models that help us in a very difficult type of phenotype of keratoconus that was a little bit challenging to achieve good results in the past. And with this new model, we are now super happy with the results that we are able to achieve. And it was very big, very well welcome for the readers in the European Journal.
In your more than 1 decade of experience in ophthalmology, how much, doctor, has changed from eye conditions that were once rare to ones that are considered more lifestyle-based today?
Well, not to go far and to focus in my area of expertise, and we can talk about the very common problem that is myopia. Based on the increase that has been seen yearly of the prevalence of myopia, is projected that by 2050, the half of the world population will have myopia. So it's important how diseases are changing, how we need to put more our efforts in to prevent, in treat, and to learn how to handle properly the disease that are expected to rise in such a big way. Imagine half of the people will have to be wearing glasses in less than 30 years from now.
Now those are definitely numbers that we won't forget. But is the team from Muscat Eye Laser Center working on any new studies? And if so, could you shed some light on it?
One of the best things of working in Muscat Eye Laser Center is that our management, our CEO, has always put deep and huge attention on research and development of technology. So it allows me to have enough time, and it allows all of our doctors not only to have time for research, also to travel to the conferences, see what is new in technology, what is new in treatment options for our patients. The different projects we are working on are not only projects that we are doing here in-house. We have several different cooperations with doctors in different countries and with industry. So we have something that is called multi-center studies, so are studies that are done in this center, in this clinic, and also in several other clinics in different parts of the world. We have cooperations with doctors from Brazil, Switzerland, Germany, Spain, Lebanon, Italy, you name it. And we are working now in a very interesting project that is with a group of researchers that are now in Switzerland, where we are trying to establish the global prevalence of keratoconus. So basically, we want to know how is this condition impact in different countries of the world. So this is a multi-center study, and the idea is to evaluate the impact in different countries to later on give back to the countries the information for them to be able to take actions in their health policies to control this problematic disease that affects the vision starting from the childhood until the adulthood.
Thank you so much, Doctor. Now, on an ending note, I'd like to understand your wish list. Now, you partook in the OERLive Digital Transformation Conference and Awards that happened in June this year. And in fact, Muscat Eye Laser Center also took home an award for 2 decades of excellence in eye care. Now, here's a question I want to pose to you. What are some technologies that you would like to see implemented in ophthalmology? And how is it going to transform surgeries here at the Muscat Eye Laser Center?
We are very lucky. As I say from the beginning, the vision of the clinic has been always to be with the best technology, with the best treatment options for our patients. So we currently have the best technology in the fields that we are dealing with in eye care. So at this point, we have the top lasers, we have the top diagnostic devices, and we will not be able to tell you we wanted this new laser or these new diagnostic devices, because we are very spoiled in that and we have the best tools available. So there is nothing that I will say that I'd like to have now that is available, because we already have it. But we would like to see more artificial intelligence involved in our diagnostic devices, more artificial intelligence involved in our treatment devices, in our lasers. For example, we are working in 3 different projects that involve artificial intelligence. For the diagnostic devices, already to suggest what they are seeing just by using internal neural networks that will allow to process a big amount of information faster than the information that a human can process. So that is what we like to see, and that's why we are working with the different groups in artificial intelligence in our diagnostic devices, and perhaps in the future to have also this artificial intelligence in our treatment devices like the lasers, for example.
Thank you so much, Dr. Juan. It was an absolute pleasure hosting you today, and we hope to sit with you soon in the future to learn more about this.
It's my pleasure, and thanks for inviting me.